A genetic counselor is a certified professional with a master's degree who has expertise in genetics and also medical conditions. So they're able to tie the genetic information and assess, is the medical condition that we're seeing in the family due to an inherited cause? And if so, what does that mean for your management, but also what are the risks to your relatives? So the process of genetic counseling includes taking a comprehensive medical and family history, and then the genetic counselor will be able to tell you, is it potentially something hereditary that's running in the family, and then help guide you through the decision-making process of whether or not you want to actually pursue genetic testing. Genetic testing isn't right for everybody, and so that's the role of the genetic counselor, is to help you understand the benefits, but also the limitations of genetic testing. Genetic testing can't tell us everything right now, and so they'll be able to walk you through even the specifics of things like insurance coverage or the laws that are in place to protect people from discrimination by a health insurance provider if they are genetically positive. And having a dedicated genetic counselor on the healthcare team, that individual is going to help walk you through that complex translation of that genetic information, but also how to translate that to your relatives, because that's a difficult conversation to have. So part of a genetic counselor's dedication to who we see is making sure you have the tools to communicate that to your family and help get your family resources to understand what they're potentially at risk for. Precision medicine is the idea that medicine can no longer function under a one-size-fits-all approach. So it's about using someone's specific circumstances, environment, and genomic information to tailor screening and treatment to improve disease outcomes. One example of how precision medicine might be used in practice is in the case of familial hypercholesterolemia, or high cholesterol. So a lot of times individuals with high cholesterol go through a lot of trial and error on different medications, different statins that have side effects that might not be working for them. But if we can do genetic testing to identify either how they react to those medications, how their genes interact with those medications, or just if they have an inherited risk factor that might steer us toward another medication that might be more effective, that's a more targeted, streamlined way to get you on a medication that's going to work for you and lower your cholesterol. And so it is less trial and error and more understanding. We should start with this medication because we have data that show that this is going to be better for you. TriHealth has a dedicated precision medicine institute, so we have genetic counselors who specialize in multiple specialties: oncology, pharmacogenomics, cardiovascular, general adult genetics, perinatal. So we have a lot of expertise in different areas, and genetic counselors work across specialties to help patients get the most comprehensive care that they can.